Hey guys, it's Angie from Essential Infusions. Just popping in here tonight by myself tonight. I'm going to chat about something I discuss with all my patients. Sorry, my dog's a little needy. So as I've dug deeper and deeper into the functional world, I learn more and more things and how complex the body is and how it works together. So, sorry, he's a big boy. One of the things I've discovered is that we lack often evaluating things that can affect so much of our body. And one of the things I've discovered that we often do not evaluate in medicine is our iron levels and how important they are, and not just iron, but our iron stores as well. So I wanted to talk to you a little bit about this, and I took notes, so I wanted to make sure I covered things appropriately. So iron deficiency and iron deficiency anemia are really, really important for our overall health. So it is actually defined, iron deficiency, not anemia, but iron deficiency is defined as when your ferritin level is less than 50. So let's talk about iron. There's iron, which is the active part of your hormone. This is the iron stores, and that's what actually your body uses to make hormones. Ferritin is your iron stores, and that is what's used to make your RBCs, your red blood cells, and they're both equally important. You actually are only defined as iron deficient anemic if it actually starts to affect your hemoglobin. So very, very often you will see a low ferritin, a low iron store, and a normal iron and a normal hemoglobin. So you won't call it anemia at that point. If it gets worse, then you'll see low ferritin and low iron, but you'll still have a normal hemoglobin. It's still not iron deficient anemic. But once it gets very severe, then at that point you will see a change in your hemoglobin. But typically when you go to your primary care provider or whomever, they don't check an iron panel. And if they do check an iron panel, they often don't check a ferritin level. So it's very important to know that this could be missed very often when you go see somebody. And this is why I started to add this to all my lab panels. So what are some of the symptoms of iron deficiency? So a lot of the symptoms are similar to what people think thyroid are. So fatigue, shortness of breath, you can have palpitations, you can have hair loss, the cracks on the corner of your mouth, that's a sign of iron deficiency. Also pica, or where you really want to eat things that aren't necessarily food. One of the things that comes to mind for me all the time is ice. People who really want to eat ice all the time, they're likely iron deficient. And it's really important to notice those signs before they start affecting the rest of you. But people just feel really, really crummy on this. Why do we become iron deficient? What are some reasons for that? So it's usually one of two things. One, you're not absorbing enough iron. So sometimes vegetarians or vegans will be iron deficient, and they're not absorbing enough iron. Or people who, I see this very often in women who are menstruating. They have heavy periods, and so they're menstruating, and they're losing a lot of blood during their month. And so when I say heavy periods, and I didn't realize this until more recently, but a heavy period, a heavy menses would be described as using more than or soaking more than 5 Super Plus tampons throughout your entire period cycle. So however many days you have it. So that means completely saturating it. If you think about it, that's really not a lot. And I think so many of us have been tricked to think that it's normal to bleed heavy. And I can tell you, even as a healthcare provider, I didn't know how heavy I was bleeding. I didn't know how heavy my daughters were bleeding until we started to really look into this more and realize that we were all having heavy periods and we're all iron deficient. And definitely can add to issues with concentration for kids in school, fatigue. But I do think kids in particular, they just don't know, they don't feel good. They just don't know they're not feeling well. And so for our young women in particular, it's really important to check those levels and make sure they're sufficient. So talking a little bit more about the iron source. So when I look at an iron panel, I'm looking at your iron level, I'm looking at your ferritin level, and I'm looking at how saturated that is. So we want that iron level above 80, and we want that ferritin level above 50 for sure, but closer to 80. And we really like those two numbers to be close together because patients feel kind of crummy if their iron levels say 126, but their ferritin's only 85. They don't feel as well. So if we can get those numbers close together, it can be very helpful in helping them feel better. We also look at the percent sat, so how many of your sites, your receptor sites, are actually being used by iron. So if we think about this, if you have an iron number of 100, but your percent sat is 10, which is still in that normal range, you're only using 10 of those iron molecules to make your hormones. So not a great number. We really like the iron number to be 80 or above and the percent sat to be greater than 40. So you're really able to use 40 or 50 of your iron molecules to really support the rest of your body. You cannot separate one system from the rest. Iron supports your red blood cell protection. It supports your thyroid. It supports your cardiovascular system, your hormones, so many different things. And so it's really important to realize we have to look at your body as a whole. Lots of times people who complain of being ill often, it's because they have low iron or low ferritin, or they have low vitamin D, or a combination of both, or they have low protein, or maybe all of the above. So these are things to consider if you're someone who's like, I always get sick. Well, these are things to look at and say, well, is there something we need to do about this? So how do we fix this? So if you are someone who thinks this could be you, we're happy to check that for you. I check that on every single one of my patients who walks in the door. I check an iron panel with the ferritin because I identify it so frequently in so many patients, including myself. And I had no idea I was so iron deficient. And I'm greatly iron deficient. I'm pretty iron deficient. So I'm working on getting that up in my body as well. So I'm preaching to the choir, guys. I'm talking to myself just as much, but different ways to fix it. So definitely increasing, if you're able to increase your red meat and how much food you're eating that has iron in it. So red meat, your leafy greens, nuts, eggs, all of that stuff has great sources of iron. Liver, I can't do it, but that's a great source of iron. So if you can eat that, go for it. That's a great win for you. But I can't do it. I just can't do it. It just makes the whole house smell terrible. I just can't do it. My mom will probably never get liver again because I won't allow it in my house anymore. But it's a great source of iron for sure. It's definitely good for you. But if you're like me and you can't do enough by taking enough of that in, using a supplement such as reacted iron, we use orthomolecular a lot in our clinic, and the reacted iron supplement is not an iron sulfate, so it's not the kind that actually makes you constipated, but it definitely can support your iron level. So typically I recommend 2 of those in the morning and 2 of those in the evening, but you have to take them with vitamin C. So we have to talk about the cofactors. So we're not just doing iron by itself, we're also adding the cofactor. So vitamin C, if you're not aware, there's no maximum dose for it. You can take a lot of vitamin C. What does stop a lot of people from taking a ton of vitamin C is it is also a natural laxative. So you have to just build up till you're able to tolerate that. So if you have chronic constipation, if you're not pooping once or twice a day, take more vitamin C. Not only will it help you poop, but it's a great antioxidant. It can help your immune system. It's got so many great benefits. And it's one of the reasons why IV vitamin infusions have really just boomed in the past few years, because there's so many studies that show high dose vitamin C can be helpful in so many different ways. But just so you're aware, you can take a lot orally just by pills. So take your vitamin C with your iron. Take that with food, but take it away from, say you are taking an antacid or something for acid reflux. You need to take it away from that. You also need to take it away from any calcium. So don't take it with cheese or milk or yogurt. Take it with your meat. Take it with your veggies, that type of thing. Take that twice a day. It's great for your health. Another cofactor that you need for iron is vitamin D. And again, that's something else I check on all of my labs for all of my patients. Vitamin D is so important for you. The bottom level for our lab is 30. I optimize patients between 60 to 80 because you really need a higher level of vitamin D to protect against so many different cancers. And if you missed that, I did a whole Facebook Live on why vitamin D can help protect against cancers, and just a whole thing on that. So feel free to search back and look at that, or go to our YouTube page and take a look at some of the different ones we've had. But I talked all about vitamin D. Really getting to that 60 mark is really important. And I promise you, if you live in Northern Illinois and you're not supplementing, you're quite likely deficient. Almost everybody is. So vitamin D has to be optimal, not just sufficient, optimal. What vitamin D does is it pushes down hepcidin, and hepcidin prevents iron from binding. So you want to have as little hepcidin as possible in your body so that your iron can bind to the receptor sites and be utilized by your body. So iron, vitamin C, vitamin D, super, super important. All three of those need to work together, taking in enough food. So another reason I do see low vitamin D is because people aren't digesting food well, or they're not absorbing food well. So people who've had their gallbladder out, or have problems with acid reflux, or have had any kind of bariatric surgery or any intestinal surgery, where they have problems with IBS or chronic diarrhea or constipation, you have gut problems and your gut's not absorbing what it should be. And so really working on that. Sometimes people need digestive enzymes with their food to be able to absorb the protein. Sometimes people need, most people need a good probiotic to really optimize the microbiome or the bacteria in your gut. Sometimes you just, it's not enough. If you've had part of your digestive system removed, you need to supplement. So iron deficiency, it's a thing. If you're tired, if you have hair loss, if you eat ice a lot, or have cracks here, or have a smooth tongue, or have palpitations, it could be your iron. It could be your ferritin. If your doctor or your primary is not willing to check it, I will check it for you. It's something that needs to be looked into. It's something that can be corrected with the right approach. It does take time. It doesn't correct overnight. And it is something that needs to be followed, just like your vitamin D. You need to follow that. So you need to recheck your labs once you start supplementing with this to make sure we get you in that sweet spot and don't overhit it. So that's a little information about iron deficiency anemia. I hope this is helpful. I hope this just brings some education to you about some of the symptoms you may be having. You're not crazy. You're definitely not crazy. There's things that are going on with your body, and just some ways that you can help your body optimize and thrive throughout life and just really feel great. Because that's what really my goal is, for all of you guys to feel great and to live your life to its fullest. So thanks for checking us out. Go to essentialinfusionsplus.com if you want to check out more of our information. We have a YouTube channel. We're on Instagram, TikTok, all the things. Feel free, please like and share us. And post any questions you have below that you want me to address. If you have questions about certain things, I'm happy to look them up and to get the information out to you. It's great talking to you guys. I will see you soon.